Stop wasting your marketing budget on your startup until you see this. Figure out how you don't have to carve out a huge budget to scale your company. Today, we interviewed a founder that have spent $0 on marketing, yet created 200,000 users across 44 countries. See how you can do the same.
Welcome to Provider's Edge, the podcast that helps healthcare entrepreneurs and innovators break down barriers and control their business, life, and future with valuable action steps. With me, your host, Sabrina Runbeck, a recovered clinician and a business deal catalyst. Let's rewrite the rules and create a positive social impact while increasing your profitability.
The exciting thing about attending conferences is to learn and be exposed to these amazing solutions that can be able to support us as clinicians, our patients, our caregivers. Now, sometimes it feels like we've been drowned by too many solutions that sounds similar. Yeah, how can some people able to stand out? We went to Vive this year and interviewed many of these solution providers. A few really stood out. Number one speaker that we're featuring today is Dr. Pinkey Patel, someone who created a solution that combining her pharmacy background with a identification of seeing there's a 30% drop in postpartum care. So she was able to film multiple clips while she's pregnant and launched her solution, Myri Health. Let's hear from her and take into consideration of how she's able to, without a marketing budget, create a 200,000 users onto her platform and expand into 44 countries. Hi, this is Sabrina Runbeck with the Caregiving Worldwide Network here at Vive, and we have another excited innovator founder here with us, Dr. Pinkey Patel. And so please, thank you so much, first of all, being here. It's exciting to be in the room with some amazing people, right? And tell us a little bit more about the mission truly behind your company and what's the story like?
Yeah, so Myri Health was developed because of my experiences in postpartum and pregnancy. So I am a pharmacist by trade. I have my doctorate in pharmacy, but I'm also a pre- and postnatal corrective exercise specialist. So after having my daughter in a 60-hour unmedicated labor, I felt like that would have been the most hardest part of motherhood. I've done my job, right? And even getting her out of my body the way that I wanted to have the birth, I had a doula. I felt like I was very health literate, but when I walked out of the hospital, I felt like it was unusual that the first appointment was for the baby, and there's nothing for mothers for up to 6 to 8 weeks. So 40% of women don't even make it to that 11-minute appointment. And so I found it interesting that we also didn't integrate pelvic floor therapy for mothers. So whenever I built Myri, I always questioned, well, when I had my child, I had a phone in one hand and a baby in the other. And so I wanted to build something that was evidence-based, rooted in science, and was clinically driven to provide better outcomes for mothers. So that was the story around Myri. I actually built Myri while I was pregnant with my second one and launched it on the App Store 3 weeks before birthing him. So that was how we started. Now we actually work with women right when they get pregnant. We keep them healthier during pregnancy, and then we hold their hand the entire time during their 4th trimester.
That's amazing. It's always have that strong bond with where you come from. You see the gap, and especially with having clinical background, we actually realize the system is not really working for us.
No.
There's so many things that we could have done better, but even as clinicians demanding the system to change, that's not going to happen.
Right.
We can take it into our hand to say, what could it be? We can find the right resources, the right technology, the right people to help us to build this. So it's amazing to be able to do this. And while you're pregnant.
I was pregnant. I was planning on not being pregnant. And so when I filmed over 800 rehab exercises, I was 10 weeks pregnant. I held my stomach in, rented a co-working space, and filmed all of it before the stomach popped out, because I had to run very lean and I was bootstrapping. So that's how it started. But I had a deadline because the baby was coming out. So I was like, well, I have to put the app on the App Store. So as a recovering perfectionist, I was not ready, but there's never really a good time. So clinicians are kind of the worst because we're like really big perfectionists.
Yes.
So being in this entrepreneurial space, I've learned a lot.
Right. It's like what really helped us pushing over. We also needed to be able to say, good enough is good enough.
Right.
We have to get it out in the right hands
Exactly.
to test it, so then we can get feedback to make it even better.
Exactly.
So that being said, what has been some of the really useful go-to-market strategies you guys have been able to leverage, adapt to truly get it to the right hands?
So we started D2C, right, because I had no choice, just put it on the App Store. We garnered 44 paying countries and over 200,000 users without a single dollar spent on marketing. It was just me, I was still working full time. We used that 3 years of experience with D2C consumers to then pull data from their outcomes. What were their outcomes in terms of pelvic health, mental health? We worked with self-insured employers, and now we have positive feedback from NPS scores. Now is the time to take all of this data that we've collected in terms of what we've done for their health and position it to our B2B partners. So Medicaid lines of business where accessibility and affordability is what they're looking for, and also health plans as a preventative benefit. So we've kind of pivoted. We still exist on the App Store. People still pay for the application, but we're also going to market strategically in other countries.
That's amazing, because we know women's health and delivering the baby, as you're thinking, well, I thought that was the hardest.
Right.
But what about all the care afterwards? We have so many people that has postpartum depression even. So how do we help the entire journey and not just a moment or just focus on the baby? It's really a whole family support that we needed to come into. What have been one of the biggest wins you guys had?
One of the biggest wins would have to be the engagement. So when we say that, oh, our app garnered all this interest and revenue and usage with our beta product, that signals something to me. Because if at the end of the day, if I sell to a payer or a public health organization or a community, you can sell something to someone, but are they really going to use it? So the fact that our initial MVP was able to do that, now we're just evolving. I think a big win for us is that we've been able to identify what works and what doesn't work pretty quickly. So as an entrepreneur, to be able to pivot and adapt to the environment has been pretty great. But in terms of our biggest wins is just our user or the usage base, the engagement within the application.
Exactly. Finding out what people, how they're doing it, what are they using on, and actually have some data point back, so then you can start pivoting and then getting down to the right location.
Because it's like non-linear at all as an entrepreneur and founder. But when you finally find that spot of like, wow, these individuals are finding a value in what we're providing. And not only that, we actually have outcomes now. That for me is a big win, to say that, hey, I have an idea and I think this is going to improve lives, and then to actually get that data back and say it worked.
That's so heartfelt. Like that's accomplished, right?
Yeah.
Like no matter what we built, it's getting that feedback to say, wow, okay, this is really making impact, and that's what.
And the testimonials, they're on the App Store. They say that, hey, with my first child I didn't have this, but with my second I did. I'm not peeing on myself. I don't have back pain. I don't have pain with intercourse. Like women we're basically told that these things are just normal, but we always say they're common. They're not normal. We as a society have a narrative that's been around for a very long time, and so to break that narrative has been a challenge, but the testimonials speak for themselves, and stories that are shared, you can't, that's kind of like where we started. Our community was very valued, and I say that when women start sharing stories, that's when you really understand what their pain points are.
Correct. We actually have to get to the people who are able to be brave enough to say, this is how I felt. This is
vulnerable.
Not okay. Vulnerable. Yeah. Exactly. And I see my friends going through pregnancy and have all these issues. Yeah. And then it becomes like, I don't know, I'm just get busy going back to work already, and then wasn't even addressing some of the concerns.
You just kind of fly over it, because we have the shortest maternity leave of all of the countries. So whenever they say, why do we have postpartum depression? I was actually asked by a country, can you help solve our postpartum depression? I said, do you know how it works? It happens because of a collective movement, right? We don't find support in many areas of pregnancy and postpartum, so then we end up with a mental health disorder that often goes undiagnosed.
Correct. So if I give you a magic wand, which tap into your previous thing, get rid of one major thing right now and truly push this over to get to the finish point, what would that be?
Like to get Myri into the final go-to-market?
Yeah.
It would make it my greatest challenge right now, which I would love a wand for, is the ability to integrate with multiple care plans, because that is I've learned that is why it's so difficult to innovate, especially in the US, because everybody is using a different system. And the pathway to get to the final goal is not just linear of like, oh, you all use the same, so great, we'll integrate. Everything is taking longer because there is a different system involved to get to the end user, right? Because we just want to support the mother. And to get to that mother, there's about 20 different hurdles that we don't think of. So removing all of those integrations would be very helpful.
Yes, it's to not just have every single system wanted to be unique, but it's actually a true barrier.
It's a barrier to entry.
Going across everything.
Right. Yeah.
And when you have this amazing technology, you have to have new conversation with each system and figuring things out. That's why we have so much delay in things that we know is good, but actually getting things done, it's become so convoluted.
It has.
Now, we love Vive, we love conferences in general.
Yes.
So what truly brought you to Vive, and what do you want to get out of the most?
Yeah, so last year I came to Vive on a sponsored ticket. I didn't have a booth. I wasn't selling as much. I was figuring out who I was really selling to. This is our second booth. I went to Health after that first Vive. And so we've really evolved in the last 12 months. I came to Vive because of the individuals that are here. Everybody's under one roof, right? Whether it's an investor, we're raising capital, or whether it's a buyer. So, and then there's also other founders. Like we see our founder friends and we grab them when we're like, this is what's going on. You really find your community there. So you have to lean in on that community. But then you can share your stories and move on, and then learn from each other, because this is a very difficult environment to do business in, also like just in general. But Vive particularly and Health have been great for us because it's everyone under one roof and we can share ideas. And also there's others looking for solutions and we're able to have those conversations and just learn. Yeah.
Exactly. It's about that shareability. When you're physically with someone, you have that attention.
I'm so tired of Zooms.
Yes. Yes. And then otherwise it's like, okay, what's your virtual background? Okay, how do we just simply have a conversation, be normal, and then actually enjoy each other's presence.
Right.
And that's what conferences.
And actually learn about one another and like share the stories, because on Zoom, it's like Zoom fatigue from the pandemic.
Yes.
Right? So yes, it's nice to be here in person.
How can people find out more about you guys, and what do you really want people to get out of it? Who do you truly want to speak to?
Yeah, so you can find us on Instagram, LinkedIn, our website, myrihealth.com. You can also find us on TikTok. We share a lot of information there. We're always reaching out to mothers. Mothers actually buy it directly because it's there. They find value in it. It's easier than going into a physical therapist or Googling, for instance. Yeah. And then we are actually reaching out to public health organizations, employers, and payers. So anybody that wants to bring in a science-backed resource into their entity, we're willing to work with them. And it's a very seamless integration. We've finally figured some things out where we can integrate. Yeah.
That's amazing. It's always seeing the hurdle, but moving forward to it, and then one step at a time. And even though sometimes I have
to remind myself one foot front of the other.
Right.
But as founders, we have like low threshold of when things get done, and we want them at a high velocity. So I have to remind myself that we have moved forward. It just takes longer. Everything in this space takes longer. Healthcare does, unfortunately.
Right. It's like we can move in the speed of light, but we need to make sure everybody behind us can catch up, so we don't create too much a gap that they start getting lost.
Exactly. And also fundraising, right? We're raising capital to be able to expand our resources and meet the needs of the providers. So that's always something that we're doing as founders. Yeah.
Well, I so appreciate you sharing this, your story, and then being amazing to be here at Vive.
Thank you for having me.
As many solutions emerges in the healthcare technology and innovation space, what has been something that connect with you so personally? Just like Dr. Patel, she leveraged her personal experience, able to find a specific gap and did something amazing with it. Now, do you have a solution that you're building for your organization, for your own company that has a deep-rooted connection and understand the clinical background of how that can be plugged into what doesn't work in the current healthcare system. Because no matter what, we're looking for solutions that's simpler, that's cheaper, and that's more effective. Are you able to hit all three areas while you're pitching investors or connecting with a large organization to be partners to support your initiative? Now, our second speaker is Emily from FlexTogether. Knowing that Medicare has decreased its amount into rehabilitation, especially into pulmonary rehab, where my subspecialty in thoracic surgery, we are always looking for these patients to get the proper rehabilitation before and after surgery. And many of them are really difficult to find. So she's able to combine both technology and clinical support to help these patients. Let's hear from Emily on how she really created a strategy to take her solution into enterprise deals that she is able to lock down. Because we also know many companies, despite raising funding, only 15% are able to create that B2B relationship, tap into the enterprise level of success. Now, if you have a story to tell and believe that your solution deserves recognition, now apply to our annual Impact Award at postpointpass.com/awards. We're looking forward to spotlight your work and connect you with our venture capital partners. All right, look who we have here. Yay, Emily is here with us, and she is from FlexTogether. And thank you so much for joining us at Vibe.
Thank you so much for having me. Super excited to share what we've been working on.
Yes, and so tell us a little bit more about your mission. How did this all come together?
Yeah, so at FlexTogether, what we are doing is we're radically expanding access to pulmonary rehabilitation. So the reason this came together is because not enough lung disease patients are getting access to this really amazing service line. So less than 3% of Medicare beneficiaries, even 1 year post-discharge, are getting access to pulmonary rehab, which helps patients breathe stronger, it helps them have more healthy days at home, and really helps them embrace new social connections and do all of the things that are not going to the doctor, right? Which is why we get healthy to get out into the community. And so, unfortunately, my co-founder's father was diagnosed with a chronic lung disease that really inspired us to start this journey. And we really wanted more people to access a service line that can really, improve lives.
Exactly. So my background a little bit is in thoracic surgery. So we always send patients before they go into surgery and after. And definitely access to pulmonary rehab, it is a tough thing because not many facility have it, or even in the hospital systems, it's tough. So I'm glad that you guys put that together. So tell us some of the wins that you have so far.
Yeah, so we were part of the Cedars-Sinai Accelerator program, and so we've been seeing patients in California. We're also able to see patients in California and Vermont, and soon we're going to be in Tennessee as well. So how the program works is we accept referrals from specialty and primary care providers. Because we have physical, speech, and occupational therapy, we're able to do synchronous telehealth visits on our own platform. Super easy to use. We worked with the AARP Foundation to make sure that it really makes sense for older adult respiratory patients. We're able to really monitor them to improve the safety of it. As you talked about, these are patients that are either getting ready for surgery or just had an exacerbation. So making sure it's safe, and as well as really fun. We have yoga, we have qigong, cardio, dance. I think, some of the struggles that those in-person pulmonary rehab centers have in addition to capacity is that they sort of rely on treadmills and bikes, and that might not be for everyone. And so just giving patients an option to be able to see us, be able to do it in the comfort of their own home, be able to be enrolled in insurance, and really get the opportunity out there.
Right, the diversity and choice of what they can do.
Totally.
And sometimes it's that humans feel more empowered when we have variety. Totally. And you bring it directly to their home. It's safe, it's convenient. So tell us a little bit more on what's been the journey to go to market. Has that always been connecting with a large organization, or have you been able to go directly consumer? What's that journey look like?
Yeah, that's a great question. So we've done a little bit of both. So we started out our journey in Florida, doing a lot of direct-to-consumer as we were waiting for all of our legal to get all set up here in California. And so as we move forward, I think we would love to connect with more health systems, ACOs, IPAs, payers, really anyone who has this patient population who's not getting served, who are sitting at home declining when they could be feeling better, breathing better, and really being able to get back out there. So I think moving forward is doing more of those partnerships with health systems and larger organizations to really up the volume, because there's 53 million chronic lung disease patients, and we can't find them all by ourselves as much as we'd like to. So relying on partnerships and others who are really passionate about the space to get those COPD, ILD, lung transplant, all those patients into our service line.
Exactly, right? The African proverb, if you want to go fast, go alone. If you want to go far, go together. So it's really about the true partnership, the right people that believe in you, believe in that mission, and the outcome to truly help you go forward. And that's exciting. So let's ask you this question. If you have a magic wand right here, and then you can make anything disappear, what would be one challenge you wanted to focus on?
I think for us, it's really access. I think we think a lot about rural populations, those who might be experiencing the digital divide. Some of that we get ahead because we can send patients tablets that are 5G connected. But whether or not we accept that particular insurance line, we're getting better at that. But I wish there's a magic wand that we could be in every state and accept every insurance right away. Because when we get a referral that we can't see right away, we're like, ooh. We do have a Better Breathers Club with the American Lung Association that patients, regardless where they might be living, can join and really start to get that care and start to connect with us. But yeah, if I wish I could have a magic wand, it would be a lot of the regulation that stops us from seeing those patients with high need.
It seems like you guys have a combination of cash pay and the billables through insurance. So definitely, I think accessibility is across the board, any intervention, right? It's new. How do you show that, what I'm understanding from a patient and caregiver standpoint, as well as from the clinician standpoint, what do you think is the biggest side to help you move through better?
I think, there's a lot of ways to move forward. Again, I think to your point, awareness, and that we're not competing with in-person pulmonary rehab is really important to us, because we're billing for those rehab services, because we have speech, physical, and occupational therapists. We approach the problem in a little different way. Because of our speech language pathologists, we can actually address cognitive challenges that come with desaturation, which a lot of the in-person programs can't necessarily get to, but then they have that community element that they can do a group class. So I think to your concepts about patient choice, I think for us, getting our name out to caregivers and be able to give some caregiver respite, I think could be really influential. We can engage patients, we can help them with social isolation and loneliness. It is a 3-month program traditionally, so there's real connection and community that's built on the platform with those providers.
Right, to be able to say, this is a long journey.
Yes.
It's not something, lung disease is not something we can just fix like that.
Chronic diseases are like that, right? It's so unfortunate, but unfortunately you live with it for the rest of your life, but then the question really is how do you want to live with it, and can you live better, and can we help you, manage some of those symptoms so you can get back to playing with your grandchildren. My favorite personal health goal, if I can share, one of our patients, her goal was to get up the stairs without taking a pit stop, which I just think about is just an amazing, achievable goal. And so we made our whole program around how do we get her, strength, and how do we get her, stamina up that she can make it up those stairs. And that was what she was really looking for. So those stories that really keep us going.
For sure, just like our lung cancer patient, the only thing that is for him to walk down the aisle for his daughter. So those moments is what keep driving us despite the challenges dealing with policy changes, individual adaptations, or how do you really make sure everyone understands you. So I so appreciate it. How can people find out more about you guys or reach out to you?
Yeah, so you can go to our website. It's www.flextogether.com. We're active on LinkedIn, Facebook, X, I think it's called now. So that's a great way. We have a fax line, so if you are a provider who can send referrals for physical, speech, or occupational therapy, and if you live in California, Vermont, or Florida, we're ready to see patients right away. So you can send us a referral in our fax line, and our HIPAA-compliant e-referral form is also on our website.
Perfect. And right before I let you go, we always love events, and that's why we're at Vive. So what is the biggest thing you wanted to get out of being here?
Yeah, I think to your point, really, it takes a village. I think we're really looking for referral partnerships to be able to reach those patients in need. We are also fundraising as a company to really take it to the next level. Thus far, we've had pulmonologists invest in us and other really interesting strategic visions, but we really want to be able to tackle that 53 million patient population, and to do that is raising a seed round as well. So hopefully finding some really great partners in that capacity as well.
I appreciate you. Thank you.
Well, thank you so much for having us, and as we say at FlexTogether, breathe strong.
So our two speakers today have a common theme. When you know the need of that you're providing, the problem yourself so clearly, and have both the clinical background and relationship that you have built, then you don't have to throw money into the system just to market yourself. Yet you can create bigger deals than any other company that even have similar solutions like yours. Dr. Pinkey Patel showed us how you can create hundreds of users into your platform without leveraging a huge marketing budget, which means we know success all along in healthcare, technology, and innovation space does not require more funding, more capital. Yes, they can help you to go much faster. But what you have to very specifically identify is your niche, your market fit. How effective you are solving a problem in the marketplace. Now, from working with multiple healthcare startups, we have summarized 5 critical key areas that you should take into consideration. Number 1, building from a clinical expertise. If you don't have a medical expert on your platform who's helping you to grow, you better find one, number 1. Otherwise, adoption is going to be difficult for you. Number 2, creating a $0 growth strategy. What that means is how can you not needing a huge marketing budget, but still can quickly get to revenue positive instead of chasing funding every day. Number 3, developing enterprise-ready solutions. Think bigger from day one. Having that clear pathway and not just locked into a one-to-one relationship. But how can you create the leap of growth from day one? Make sure your company is scalable now, not waiting for the next 5 years to scale. Number 4, architect effective pivots. It's okay for us to change course when things don't work out. That also means you have ways to measure your success and knowing when to pivot. Number 5, scaling with quality control. When you are able to measure your success, who's the right people in your organization, or not just these title board members who are actually functional to support your initiative and knowing how to support you with the right strategy to go forward. Be very clear on who you listen to and not just everyone. When people don't have a deep understanding of your organization, even they're offering free support, they're still not really giving you an integrated solution that's comprehensive enough for you to get to the next level. Want to know if your company is ready for that high level of sustainable scalability? Take our Impact Quotient Quiz. Go to impactquotientquiz.com. For all of you guys who has created an amazing solution that has been through different test trial, have users, and is looking for the next breakthrough, we would love to have you pitching for our Impact Award. Go to postpointpass.com/awards, where every year we give out 6 winners to have multiple media exposure, as well as speaking with TEDx speaker coaches to perfect your pitch as you stand in front of investors and directly connecting investors to look at your company. It's our way to give back and being thankful for everything that we have achieved and everything that has been offered to us in the community. So go to postpointpass.com/awards. We can't wait for you to be our next winner.
Thank you for tuning in to Provider's Edge podcast. We hope you enjoy our latest episode and found the insights and tips helpful. We'd love to hear your feedback on the show and learn what topics you'd like us to cover in the future. So please take a moment to leave us a review on your favorite podcast platform and let us know what you think. Your feedback is essential to help us improve the show and provide you with the content you need to take your healthcare business to the next level. Thank you for your support, and we look forward to hearing from you soon.